If you were to try to help a client understand a little bit more about why health is more than what you eat, what would you tell them?
I would point out how, like, I think of our health as like a big pie or a big puzzle, and what we eat is actually such a small part of that pie. It's estimated like 10 to 30% of our like personal controllable factors actually contribute towards our health. And I think health in terms of food is so much more broad than one individual food or one individual nutrient, that food is also social, it's also cultural, there's traditions, it's the way we connect to other people. And what's more important with food is overall versus one individual food.
Right. And so if like a client or someone was only relying on food as like their source of like defining what health is, how would that become an issue? Or like how do you think that would affect them?
I think it would affect us by just becoming really stressed about food, which then in turn also impacts our health, probably in a negative way. That when we get so locked into one thing, it puts so much pressure on that. And then all of our food choices become more stressful or feel like they're more impactful when also we make food choices for a variety of different reasons. Our accessibility to food, our background, our capacity, our budget, like there's so many different factors that go into it, that if we just are focusing on that, we miss so many other things that can come in and impact our health.
And so I think like that makes sense too, especially the piece with like if people don't have access to food. I feel like to just be like, well, suddenly that means you're not healthy, or you don't even have the ability to have potential health in your life. It becomes so limiting.
Yeah, it turns food into a very moral thing and brings like healthism into it, where achieving health is seen as this moral superiority, and if you're not trying to achieve health, then therefore you're inferior somehow. So it actually creates further barriers to health.
So if you were to like help someone understand how to like take steps away from like determining and putting like the weight of like on food determining their health, like what would you suggest them to do?
I think one of the first steps can be really trying to like see food in a more neutral way versus in like categories of healthy or unhealthy or good or bad. Seeing food more neutrally, and also just allowing a wider variety of foods, which also includes more convenience foods or foods that maybe we see as like more processed or whatever it might be, because flexibility and overall variety and enjoyment is actually what's going to support our physical health, our mental health, our emotional health in the long term.
Right. That makes sense.